fact that there is equipment that anyone can borrow from someone else and then return it when you're through with it was somewhat of a new concept.
NERAC gets a sum of public safety money from the state via the federal government. And our responsibility is to divide that money up as best we can. This cash program allows the communities to put priorities on what their community actually needs, and this kind of subsidizes what the community has.
Bottom line is we get all this equipment, we don't ever want to use it. You know, that's the bottom line of this whole thing. We're ready to go at any time.
We came up with 3 strategically located cache locations: Beverly, Lexington, and Framingham. When there's a large disaster, the first responders in the field now have to talk to different agencies that don't normally talk on a day-to-day basis. At the Beverly cache, we have certain strategic communications equipment that would be very hard to replace in a disaster. This happens to be a 100-foot Roan 45 tower. We stockpile this equipment, and in the event that there is a tower collapse, this here can be supplied in a matter of hours, and with a trained crew could probably be erected in less than a day. We have the large tower, which is a wheeled trailer. It weighs about 16,000 pounds. It can set up in probably 15 minutes. It has a radio equipment in it that has the antenna, the towers, the transmission line, and the interoperability equipment in it. We also have what we call the Blue Sky Tower, which is a very small tower, but can be set up on the roof of a building very quickly. That's transportable by 2 people to be delivered to a city and town to serve as either a permanent or a full-time antenna should theirs be destroyed. NERAC has a 30 radio cache in the Beverly, Framingham, and Lexington cache site. They come with speaker microphones, cases, antennas, chargers, and spare batteries. All the radios have all of the regional police, fire, and EMS channels pre-programmed in, as well as interoperability channels. The 3 caches all have 24-hour contacts and phone numbers, and a participating city can call one of the regional caches, and we'll make arrangements for either the equipment to be picked up or delivered.
In our yard here at Framingham DPW, this is a 90 kW generator that used to support emergency power. It can be trailered anywhere. It can be hooked up in a matter of hours. We have 6 shelter trailers here, as does Lexington and Beverly. These trailers are equipped with cots, blankets, wheelchairs. We have first aid kits in here, so in other words, this is the first response to an emergency. As far as the trailers go, that's pretty much anybody can tow those. This is one of our portable generators. We have 4 of these. This can be used in the field to work with shelter trailers, so they could have a lighting type capabilities if the light towers that we have here also weren't available. So we have 7 light towers here that can be trailered anywhere. They're all a 2-inch ball. They all raise mechanically. And these are pretty simple to operate. There's basically 2 switches on there. One is to start the motor and one is to turn the lights on, and that's it. Message boards, you got to go in and program. We have 4 of them here. Anything that pertains to safety of the public is when they'll be used. This pump will pump about 1,000 gallons a minute of water in a flooding situation. We can set up anywhere from 20 feet away to 60 feet away, depending on the location where the flood or where the water has to go. These are hoses we have for our 10-inch pump. We can pump probably anywhere over 1,000 gallons a minute with these pumps. You can pump it out closely, but you got to get it away from the location. So the more discharge hose you have, the better off you are. These are 4-inch pumps, as they're commonly known in the industry. They're trash pumps, because they'll basically suck up anything on the ground, and they'll bring the water level down to probably 2 or 3 inches. We have a trailer that houses almost 70 of these plastic barricades. This trailer is ready to go at any time to take these barricades to any location. And we also have metal barricades that are used in more of a more permanent type situation when you're going to be there for a long period of time. This is a 15-inch wood chipper that we have used back in the hurricane of Irene. This was out for almost 2 weeks. This is another asset from the NERAC committee that has proven itself invaluable.
Through NERAC, we have several resources related to evacuation. The current inventory of NERAC vehicles for evacuation include the 2 evac buses, the 3 ambu buses, and then the 2 evacuation vans. Ambu buses are meant for medical patients, so whether it be a mass casualty incident with multiple victims, it could be an evacuation of a hospital or a nursing home. The ambu buses in the NERAC region are actually converted transit buses, retrofitted to actually support 12 stretcher-bound patients. The buses also maintain an installed oxygen system, some basic medical supplies, defibrillators, as well as radios for all of our communication safety points so that the bus can communicate with the responders on the scene. We've had different size and scopes of evacuations within the region, and the evacuation resources that NERAC has put forward, the ambu buses, the evac buses, as well as the evac vans, are all part of that system of helping us have a resource to move larger quantities of individuals in a safe manner, and something that's a regional resource available to any of the communities upon request.
When you see a spike of pandemic or flu-type symptoms, you may need additional resources. Based on recommendations from the American Association of Respiratory Care, we developed 3 cache sites. Cached at Lowell General Saints campus, we have 11 ventilators. At Beverly Hospital, we have 9 ventilators. And at Newton Wellesley Hospital, we have 7 ventilators. If a hospital needs a ventilator, they can contact Northeast CMed, which is based at Lawrence General Hospital 24/7. Another exciting project that NERAC is currently working on is a cot trailer. This cot trailer will have available 50 hospital cots, 25 bariatric cots, 10 pediatric adapters for cots, commodes, sheets, any items that they would need to start providing treatment care at a surge site. It's really great to have shared equipment because you don't have to go out and buy your own. When we have a cache site set up, we're not duplicating the services. Not every community may not need it all the time. So why not have a cache site that is shared? A community can activate whenever they need and then bring it back to the cache site once it's been used.
Every community needs to have a base capacity to take care of its people when they may be totally on their own for the first up to 72 hours before other levels of help potentially may show up. So you need to have some capacity to deal with the sheltering issue for that period of time. And you need a certain amount of assets locally and potentially regionally in which to call upon. The main asset is the shelter trailer itself. We have 18 spread across the 3 cache sites that we have across the 85 community region. These trailers are set up for a shelter of 100 people.
What will happen when you're opening your shelter, especially at registrations, you're going to have a number of questions like this.
We have what they call a shelter in a box. It's basically 3 containers that have all the assets that you need to sort of open up that shelter.
Address?
The assets within the trailer are cots, blankets, wheelchairs. We have a portable shower in that unit. There's your first aid kits, your personal care kits for everybody, and we also have a pet trailer. They at least are looking to try to meet some of the basic functional needs. But the idea is, can you on your own, within your own community, with assets that you've gotten from funding that's come through NERAC or some of the assets that are available through them to you, can you get through this period of time before outside assets become available to you? NERAC currently has 3 inflatable shelters. They're easily deployed, they're easily set up. The systems have built-in heating, cooling, lighting, so that you have a kind of a complete sheltering package.
You speak English, sir. Oh, very good.
First responders are trying very hard to organize and plan and train so that they'll be ready for that first-time event and hopefully diminish the impact of the event on the public.
The NERAC region has within it A very broad scope of different types of hazardous material. Personal protective equipment is necessary for any of our first responders to utilize during an event where they'll be at risk for some type of hazard. NERAC has, with equipment trailers, the concept is to have everything ready to go, packaged, and be transported directly to the requested site of the incident. This is one of the 3 PPE trailers we have throughout the NERAC region. This one is in the town of Hudson. There's also one in Saugus and one in Boxford. They're all set up identically. They all contain the same equipment. This is one of the masks that goes to the powered air purifying respirators. We have what's referred to as N95 masks. We have SCBA mask setups. So basically within these trailers, we're looking at having different levels of suits, different levels of protection, and the appropriate airway or respiratory protection that goes along with those. The appropriate action is to have been pre-fitted to make sure you've got the right size mask to ensure the level of protection you're assuming that mask will provide can actually be done by the proper fit mask. This is an example of one of our fit testing devices. We do stress that you do have to go through the Train the Trainer program to ensure that you're familiar with this device. The 3 PPE trailers are housed in the towns of Boxford, Saugus, and Hudson. If you just need the fit testing equipment, you're going to contact those fire departments directly and sign out just the fit testing apparatus to complete your task of fit testing your employees. If you do activate a PPE trailer, however, you will have contained in them during the deployment the fit testing devices.
We have numerous projects that we feel are very successful in the Northeast region. Probably the most effective is the STARS program. It's the School Threat Assessment and Response System. It's modeled after a program from NEMLEC, which is the Northeast Massachusetts Law Enforcement Council. It came into existence around the time of Columbine. And NEMLEC at the time realized that we had to come up with a strategy on how to respond to the similar incident in our region. So every school in the region and every municipality has floor plans that have been developed, has a strategy on how they're going to respond to active shooters or crises in those school systems. We've distributed toolkits to every community, as well as equipment and training, so that there's a universal response in every community within the NERAC region. NERAC funded a program called HEART. It's a hospital response system. We've developed programs that if they have an emergency in their hospitals, how we would respond to that and how they would assess what the threat is. So it's a mirrored project of the STARS program, and it's in its infancy now. We're just really rolling that out.
NEMLEC's a consortium of 53 cities, towns, and sheriff's departments that share resources and personnel to provide services to the region that they probably couldn't provide as individual agencies or departments. If a SWAT-type situation took place, we will have personnel there within a matter of 15 or 20 minutes because they're coming from within those communities that we service. NERAC has provided various pieces of equipment to the NEMLEC SWAT team. NERAC has recently provided us with a new armored vehicle. The Bearcat vehicle has been an effective means to operate in very hostile environments where the team is under gunfire or under potential gunfire and can provide us ballistic protection. NERAC has provided us training weapons that we're able to utilize in place of our real weapons and make for a very safe training environment. NERAC provides us with Avon face masks, a gas protection device when we have to utilize gas munitions in an environment where other means may not be effective. With SWAT helmets, ballistic shields, ballistic face shields. NERAC has provided us a robot and a transport vehicle for that robot. A very necessary tool operating in situations where we otherwise would have had to put human beings in a situation where they would be at great risk. The robot can provide us timely information intelligence and can actually communicate with hostile individuals, whereas otherwise we would have put a human being. Without NERAC as a funding source, it would be very difficult to perform our operation, what we do.
If you're going to come out, I want you to come out. Put your hands up in the air, okay?
NERAC's provided us for a rescue phone. We have a very skilled negotiator division within our team. They utilize that piece of equipment very effectively to communicate with someone who's barricaded themselves, who may be suicidal or homicidal, and they're able to communicate with that rescue phone. If you look at our society and look at some of the recent events that have happened, the school shootings that have occurred throughout the nation, we are prepared and we train for events such as this that we would have to aid local law enforcement and provide SWAT services to them. The shared resources that we can provide to any of the cities and towns within the NERAC region just basically bring public safety to a whole new level.